Okay, today we're going to go ahead and discuss asthma action plans and also peak flow meters. Your asthma action plan will be given out. It'll have the patient's name, their date of birth. It will have their severity classification, whether it's intermittent, mild, moderate, or severe, persistent. It'll have any asthma triggers and what the peak flow meter or personal best should be. This will be filled out by the provider with the patient during their appointment. There will be a green zone, a yellow zone, and a red zone for the patient to follow, and this will be filled out and also scanned in the chart so you can reference this when needed. The green zone means that the patient's healthy, they're breathing well, there's no coughing or wheezing, they're able to sleep at night, work and play. As a list of their current control medications, how much they're supposed to take, and when and how often to take it. It also has a list of their physical activity, if they should take it just when needed or with activity or and that information. So the patient will also have a yellow zone, which means there is some caution. There might be some problems breathing. There might be coughing and wheezing or chest tightness, and they're awake at night with this. It will also give a range of what they use, what they blow on the peak flow meter, and it should be between 50 and 79% of their personal best. It has a list of their relief medications and what to add or what to change that the provider has determined. The patient should feel better within 20 to 60 minutes of this quick relief treatment. If they're getting worse in the yellow zone or for more than 24 hours, then they need to follow up with the red zone instructions and also call their PCP right away. The red zone is get help now. So there are lots of problems breathing, they cannot work or play, they're getting worse instead of better. Medicine is not helping, and their peak flow meter, they're blowing less than 50% of their personal best. So that has their albuterol, how many puffs to take and how frequently to take it. If they're in danger, call 911 immediately, and that would be lips or fingernails are blue. They're still in the red zone after 15 minutes, or they have trouble walking and talking due to the shortness of breath. That would be something that they would need to call to get help for. It also has an emergency contact and the healthcare provider's name and number. I would encourage the patient to print this off and keep this on their fridge. This is what a peak flow meter looks like. This is a very old one. Some of the newer ones are square, but you can see it'll come in a box like this, and it has the red and the green zone and yellow zone on here. These are, we will give them to the patient at the visit. They are for that specific patient and sent home. If for some reason the patient leaves without it, they need just to discard this one. You don't want to ever reuse these. But the idea is they're gonna take a couple deep breaths in through their nose, out through their mouth, and then blow as hard as they can. And that'll give them the reading. So basically you're just gonna instruct them to do so. And everything, that's pretty much it.